When any elderly patient presents with chest pain and you did ECG, you did not see any significant ST elevation more than 1 mm in the precordial leads, you did cardiac enzymes and it is negative, but given the risk factors, patient is a smoker, patient has hypertension, you think that it may be anginal pain and you suspect it might be unstable angina. So in unstable angina, can we discharge this patient or this patient should be sent to cath lab for angiography? We need to decide that, right? So they developed a score to make this easy, to make this decision easy. They developed a score called TIMI risk score, and in this score, if patient gets more than 2 points, then send patient to cath lab for catheterization, for assessment, right? So what are the factors that is included in this TIMI risk score? How do you remember that? I remember like I need to ask 5 questions in history, and then I will see ECG and then I will check troponin. So what are the 5 questions? So first of all, I will check the age, if age is more than 65 or not, because elderly age is a risk factor itself for myocardial ischemia, right? Because atherosclerosis is more common in elderly age group rather than younger age group. So first is age. Second, I will check for the risk factors, whether this patient has 3 or more cardiovascular risk factors like diabetes, hypertension, dyslipidemia, smoking, peripheral arterial disease, right? Third is, I will ask patient whether patient had 2 or more anginal episodes in the preceding 24 hours. If patient says that currently I am having chest pain and I also had these kinds of episodes 2 or 3 times in the last 24 hours, that gives another point in the TIMI risk score. So one is age, second is risk factors, third is anginal episodes, more than 2 episodes in the preceding 24 hours. Fourth is whether patient had used aspirin in the past 7 days. So why did patient use aspirin? It might be for peripheral arterial disease, might be for TIA, stroke, right? Fifth is, I will ask patient whether he had undergone angiography previously and whether there was more than 50% stenosis, right? So why do you need to look for that? If patient already had more than 50% stenosis in the coronary arteries, it means that it might have progressed, right? Or that plaque might have ruptured and it might have caused this current chest pain. So 5 things that I need to ask in history: age, risk factors, third is how many episodes of angina he had in the preceding 24 hours, fourth whether patient has used aspirin in the last 7 days, fifth is whether patient had previously undergone angiography and whether angiography had revealed that the stenosis was more than 50%. So these are 5 things I would like to ask patient in the history. Then I will look for ECG, whether the ST elevation is more than 0.5 mm. If ST elevation is more than 0.5 mm, it gives another point in the TIMI risk score. And seventh is, I will check for troponin, whether troponin is elevated. If it is elevated, it is not unstable angina, right? It is already MI. So if troponin is elevated, ECG ST elevation is more than 0.5 mm, this gives 1 point in this TIMI risk score. And on summing up all these scores, if a score is more than 2, send patient to cath lab for angiography. And if a score is less than 2, so before discharging patient, tell patient to undergo a stress test. If patient can tolerate stress, then you can discharge safely, right? But if patient cannot tolerate stress, it means that there is stenosis, right, in the coronary artery, and he might need to undergo assessment for that. And in unstable angina, if patient is hemodynamically unstable, if patient is having heart failure, in those conditions, send patient immediately for cardiac catheterization, right?